Hi everyone, this is Dr. Susan Marra with Dr. Marra's Medical Minutes, and today we're going to talk about why it's so important to have relatively normal liver enzymes and kidney function. So many of the patients that I work with, not all but many, are on antibiotics, and if they're not on antibiotics, they're on herbs. And the herbs are either compounded in alcohol or in glycerin. And these substances, as well as medications, pharmaceutical medications, are metabolized and excreted by the activities of both the liver and the kidney. Those are the organs of excretion. There's 4 organs of excretion: breath, skin, sweat, the liver, and the kidney. And it's really important to have normal liver and kidney functions so that when you tax the liver or kidney by using herbs or antibiotics, that the organ can respond appropriately and begin to rid itself of the buildup of toxins and lipopolysaccharides and bacterial fragments. As the organisms get killed, the bacterial fragments need to be excreted. When the liver enzymes are elevated, the ALT, the AST, the LDH, and the GGT, when any of those are elevated, it indicates that the liver is stressed in some way. And it's highly recommended that you stop the treatment and figure out why it is that the patient is experiencing elevated liver enzymes. Sometimes it can be from fatty liver. Sometimes it can be from too quick of a die-off. Sometimes it can be they're not hydrated well enough. I mean, there's a myriad of reasons why. But the best idea is to really figure out what is stressing the liver and then remove that stress. Once that stress has been removed, then the patient can return to the therapy, but I would suggest that you measure liver enzymes every 2 weeks as opposed to every 4 weeks. With the kidney, you see that less so than with the liver, but we do see kidney stress, and especially with drugs like Bactrim. Bactrim is a sulfa drug, and it's hard on the kidney, so I always tell patients to drink extra water when you're on Bactrim. And when the kidney function tests are a little bit off, it usually has to do with poor hydration. Either that, or they're also not getting enough electrolytes. So electrolytes and hydration are super important to keep the kidney well, and then the liver, also hydration, but also just cleansing, lots of juicing. Green juices are excellent for the liver. And then sometimes we have to pulse antibiotics because the die-off is just too much for the patient, and the body can't handle it. So when the die-off exceeds the body's ability to handle it, then we have to pull back and rethink what we're doing and restart again. So I hope you found this information helpful, and I hope you have a wonderful day. Take care.